Hi, this is Eddie Lugo, and I wanted to give you an idea of what your first neurosomatic therapy session might look like. A really unique part of what we do is in assessment. We need to look at a patient's body and ask you a bunch of questions so that we can form a treatment that is specific to you. We don't do cookie cutter treatments. We're always trying to look at what the issue is for that patient that we need to treat. So beyond the intake form that you're going to fill out before you get to your session, we're going to ask you all kinds of questions, including what your priorities are. Sometimes there are pains that you say, well, they're not that important, but they're related to what the root issue is. So we might ask questions about the 3 or 4 or 5 or 6 different things that are going on, just so that we have a big picture idea of what the one central issue is. Sometimes patients have one central issue, and then that creates a lot of other issues. So we're looking for that root cause, that one issue that might be causing other pain symptoms, and that's part of what we're going to do. Then we're going to look at your body. We're going to do a posturology chart, and that's going to tell me exactly what your body's doing. Why is it that you have back pain? Well, because a certain part of your body is twisting a certain way, and that's going to make me look for the muscle that's causing the pain. Sometimes, and this gets a little complicated, sometimes the pain that a patient is feeling is not the root cause. Sometimes it's an accommodation. So very often patients are surprised when I work on a certain part of their body that's sensitive. They didn't even know that it was going to be sensitive. So again, the questions that we ask and the charting that we do very often is to find out what those root causes are that are not even necessarily causing direct pain. Sometimes that pain that a patient is feeling is a symptom of that root cause, and that's part of what we're going to do. So the first day, there's definitely going to be questions and assessment, but there's also going to be treatment. We expect our patients to get better with every treatment. So there's going to be education after the first treatment. We're going to give you some homework. The more of that homework you do, the faster you're going to feel better and better. So what we're always looking for is good results, that you're feeling better and better and better. Very often a therapist will ask a patient, well, I'm going to need to see you 2 or 3 times back to back. The reason why that happens is because if you wait too long between sessions, you're going to have this pattern where you get better, then you get worse, and you get better, then you get worse. You're not going to be able to get a lot from that one session that's going to stick permanently. Very often those injuries take years to happen. I've seen patients where they've been in pain for 10, 15 years. One session is not going to resolve all of those issues. So very often a therapist will ask, well, come 2 or 3 or 4 times weekly so that we can then take care of those issues and you get better, better, better. After that, you're probably going to have to see a patient very rarely, depending on your issue. If you're a patient with chronic issues, it's important to recognize that you are going to probably need treatment for the rest of your life, but that doesn't mean you're going to need treatment every single week. It's kind of like complaining that your car ran out of gasoline. If you drive your car, it needs a certain kind of maintenance. It needs oil change, it needs gasoline, etc. So it's a maintenance issue. If you have a chronic issue, very often after the first few treatments, you're going to need maintenance after that point, and you're going to have that discussion with your therapist. Again, a very big part of that is, did you do your homework? Are you sitting properly? Are you stretching the way you're supposed to? All that stuff is going to make you feel better and better, faster and faster.